Well, it's day 3 of the healthcare workers' strike across the U.S. The union representing Kaiser Permanente employees authorized the 3-day walkout that began Wednesday morning in several states and Washington, D.C.
Among workers' demands are higher pay and more staffing. According to the coalition of Kaiser Permanente unions, over 40 of its hospitals and medical office buildings have been impacted by the strike. Last night on primetime, John Dickerson spoke to one of the workers about whether they think the strike will continue.
Do you think 3 days of striking is going to be enough to get for the union to get what it wants? And what happens if it doesn't?
We're hoping so. We're hoping that it's enough. But if not, we'll go back into meetings and all that, and then we'll go from there. We'll see what happens. And I feel like us as employees would be happy to come back out here and, have our voices heard again.
All right, for more on the strike, we are joined by CBS Los Angeles reporter Rick Montanez. Rick, thanks so much for joining us. As you're well aware, California obviously is one of the main states with the largest amount of Kaiser workers that are striking. Have you spoken to people that are behind you there, and what have they been saying to you all morning long?
Yeah, Vlad and Marie, good morning. These striking workers say they are ready for this long-haul fight. They say 3 days. If it's not enough, they will be back on the picket lines in November because they want to receive, as you mentioned, better pay, better staffing levels. They say having all of that will ultimately lead to better care for their patients, and many of them tell me that is exactly what they are fighting for.
And what about patients? Have you talked to anyone who's had their procedure maybe postponed or delayed?
We did actually hear from several patients. We talked with someone who was at the hospital because his brother was supposed to receive surgery. That was delayed. We also heard from a woman who was heading in for her chemotherapy treatments. She says she supports this strike because she and that other man say they have seen the staffing problems. They've seen the staffing shortages, and they say they've experienced very long wait times from getting appointments to actually showing up for their appointments and then having to wait for more than an hour sometimes just to be seen finally for those set appointments.
Wow.
Has there been any discussion from Kaiser management and union representatives about the headway that they might be making in those negotiations?
We've heard from Kaiser for several times over the last few days. They say that they've made some deals. They've been able to come to some agreements. But in talking with the union representatives, they say that it has not been enough, which is, of course, why they are back here on strike. Kaiser says in California it is offering a $23 an hour base rate for its workers, but the union says it wants $25 per hour. Kaiser also says it has hired 10,000 union represented employees for all of its locations, and that should help with staffing levels. But I was talking with one of the strike leaders here this morning. She says, no, that is not enough because it doesn't account for the turnover. They've had high turnover since the start of COVID. So there are a lot of things that they're contending still. No deal reached. And if a deal doesn't happen, either in the next few days or the next few weeks, then these workers will be back on the picket lines, they say, in November.
I just want to sort of point out that it's obviously very sort of loud behind you, and it almost seems like a festive environment. But this is really sort of serious stuff, serious issues for the workers there. You're in California where they passed a bill that's going to make it mandatory for the minimum wage, I think, for fast food workers to be $20 an hour next year, which is, essentially what they're making.
Right. It's getting very close to, these workers, they are trained, they are educated, they are long established professionals, a lot of them have talked about. I was speaking with workers at several of these locations across Southern California who say they've been with the medical system, with Kaiser, for some of them 5, 10, even 20 years, and they say they're just not getting paid enough. And then to hear about other workers getting this minimum coming from the government, they say Kaiser can give them what they're asking for. Again, only $25 an hour, they say, here in California. A lot of these workers say, the cost of living here in California is high, much higher than the rest of the country. So they really just want to keep up, is what they say.
All right. Rick Montanez, thank you very much.